Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about.
Well, hi, everyone. Welcome to Alzheimer Speaks. I'm thrilled you can be with us today. We're going to be talking about building generational bridges and how to do that through the use of technology through the HeroGeneration system, which supports families through, the dementia ride and aging in general. It's just a nice way to be able to connect with one another and reduce stress and increase joy and get back to living life. So before I introduce you to our guest, I always just like to thank everybody for coming out and listening to our show. Feel free to pass it along. There's always people in your sphere of influence, many who you don't even know are dealing with this, that appreciate seeing this type of information be shot past them on, if it's Facebook or Instagram or Twitter, whatever it is that you use. Feel free to share. Those things matter a lot to so many people. And then I also want to, again, just encourage people to go to alzheimerspeaks.com. Check out all of our free resources there. We do much more than just the podcast here. There are free tools. There's conversations led by people living with dementia that are extremely fascinating and so helpful when you're caring for somebody, or maybe you're someone diagnosed and looking for a little hope. You'll get a lot of that there, along with information on memory cafes and dementia-friendly communities, dementia in the arts. So please go check that out. And then our sister company, Dementia Map, is a global resource directory. So maybe you have a resource and you want to input it. It's free. Of course, we do have some paid plans as well, but very simple to do. And if you'd like a tour of the site, I would be more than glad to meet with you on that. So let's go ahead and meet our guest. Well, Nicole, I am so excited to have you with us today. I absolutely love your app, and I can't wait for you to share it with our audience. But before we go there, do you mind just introducing yourself to our audience and how you even got into this space?
Absolutely. Absolutely. Thank you, Lori, first of all, for having me and for allowing me to share about HeroGeneration and get the word out. I came to this to be the founder of HeroGeneration from my personal caregiving experience. My parents were not affected by Alzheimer's or dementia. However, both my grandmothers were affected by it. But my story really started with caregiving for my father. He had faced a battle of cancer for about 15 years. And towards the end of his battle, I was supporting my mom, who was caregiving for him. And I come from a background of startups and tech. And so when my dad was, stopped all further chemo treatment for his cancer, that's when I started really turning to look for some place that could help me organize everything that was going on in this role of caregiving. Because as we all know, you're just thrown into it. Hardly anybody is ever prepared. And so I was looking for a place where I could organize, things that were happening, things to do, find information. I had a huge family that wanted to help, how I could bring them in to help me. And I really didn't find a platform to support that in ways that I felt, I needed. And so my dad passed in 2015. And fast forward a few years, my mom, who had always dealt with an acute lung disease, a chronic lung disease, needed much more support as she was living on her own. And so I became her primary caregiver, also while raising two very young children. And so again, I came to a place where I was looking for a platform. I was used to organizing my work, organizing stuff for my family online. I was really looking for a place to organize all my caregiving responsibilities, all the to-dos, all the, legal information or the legal documents I have for my mom, her doctors, her medications. I was suddenly helping her with her subcutaneous pump of some like really expensive heart medication, So I, again, just didn't really find anything that could support me in addition to finding community. I was relatively young at the time, and finding other of my peers who are going through the same thing was very, very difficult. And so I felt really alone and really lonely. And, as I moved forward in my caregiving journey, realizing there are so many caregivers of all shapes, stripes, ages, backgrounds, conditions. And so, my mom passed in 2021. And it was after getting through all of that I really tried to put down on paper what I would see as a solution for caregivers across the board, not just one particular condition. And that really was the genesis of HeroGeneration. My co-founder, Dr. Shruti Roy, is a physician. She is enduring her own caregiving journey right now. So together we have built and continue to build HeroGeneration from our personal experiences as caregivers. And, I will say in regards to Alzheimer's and dementias, I mentioned both my grandmothers. I have several family members who are going through it, have gone through it. So, caregiving touches so many of us. I always say to people, if you're not a caregiver now, you will be. And we wanted to really build a platform that supported caregivers throughout their journey and across the board could give them ways to organize their role, bring in family and friends to support them in the journey, as well as help them connect with community and really access the amazing resources that do exist out there.
Yeah, there is a ton of them. And I like with yours that it does overlap all of caregiving. Because, you could be a new mom, you could be divorced and things change.
Right.
There's so many different pieces of this puzzle. And I think sometimes we separate everybody so much and we don't see the overall usage. People are like, well, that's just for that. And it's like, no, the lessons that we learn are applicable throughout life. And organization is key because there's just not enough time in the day. We don't have enough time in the day before the caregiving role hits us. And then you're like, a deer in headlights. Like, I don't even know what this means. I don't know where to go. And I also loved when you said, you want to connect with other people, to support, because that's your lifeline. People that actually understand, because sometimes, I don't know about you, but I felt like people were talking at me. Like, okay, I gave you 10 minutes, do these things, skedaddle. And it's like, well, 10 minutes doesn't sum it up. And it's not always appropriate for your particular situation.
Right. What I found too was that when I was my mom's situation was very different from my father's. With my mom, she was still relatively healthy, but I was going to every single one of her appointments with her. I was clearly her primary support. I was pregnant through part of that. I had children, it was the healthcare that my mom received was phenomenal. She had a very, difficult lung disease that affected her heart. Like, what she got was phenomenal. I would say, though, not one time throughout that whole multi-year process, in and out of hospitals, emergency rooms, regular doctor's visits, etc., did somebody turn to me as the caregiver and say, how are you doing? Do you need support? We see that you're, really involved. Do you need any support? And that's not a knock on doctors or healthcare system at all, because they are so overwhelmed and they are doing exactly what their job is. My mission is to incorporate caregiver care and outreach into those visits, because that is really such a primary opportunity to support the healthcare. We know that caregivers are such an integral part of healthcare now, more than ever, and will continue to be. I want the caregiver to be part of that healthcare system, healthcare team, and for resources to be given to them as well, at the point of, healthcare when they're there and it's most acute.
One of the things that's not talked about is just how our family structures have changed in community. And so when I was younger, I'm 66. When I was younger, families just pitched in and they all worked together, and the neighbors were there, the church was there. I mean, everyone stepped in and said, how can I help? And that is a drastic change. Families living all around the world now,
right.
People not being as involved in their churches and things,
right.
Or even knowing their neighbors. And I blame that on the garage door opener. People, drive and they pick up their mail. They don't walk out and see each other even there. I mean, it's just, there's a lot of little things that have changed. And so we didn't rely on the doctors as much for those things, because there was this, support system that we had as individuals, as part of our community. And that's not there for I would say probably 95% of the population. It's just not there. And even when people do want to step up, they don't know what it's like. And sometimes it can just be even exhausting for the primary care partner to explain it, because it's like,
absolutely,
I don't have the time to do that either.
You are 100% correct. And I experienced that myself in that, I think I mentioned my dad was one of 8, and I have a huge family that's very supportive. But when you're the primary caregiver and you have that knowledge base of everything and it's trapped in your head, it's oftentimes, for example, my brother would offer to take my mom to a doctor's appointment, and then he'd ask, okay, where's the doctor? What do I tell them? And I'm like, you know what? It's okay. I'll just do it. It's much easier for me to do that. So that's what we really tried to solve for, exactly what you're saying with HeroGeneration, in that I do believe that there are still people that want to support the caregivers, right? You still have family, you still have friends, and we may be connected over Facebook or, social media now, but it's just, there was just no easy way to bring in that help. And so we really created a way for you to build a team. So you would just invite people to be part of the team. They just have to accept the invite. And then you can go in and make your to-do list, and you can assign different things super simply to folks. And so the next time somebody says, oh, what can I do to help? You can do 2 things. You can either say, oh, I'll just assign you something. And they're like, great, thank you. Because people want to be part of the support structure, right? They feel you still get that good dopamine hit or whatever, the serotonin levels go up when you're doing something good, especially when it's family. And, but it hasn't been easy to do, especially when you're spread out all over the country or whatever. So you can send somebody, for example, assign somebody to buy a shower bar off Amazon, right? That offloads not only the cost and the time it would take you as a primary caregiver to do that. So we're trying to really solve for exactly those problems that you bring up. because with technology, there are some advantages. There are ways that we can, we're not going to get back the church structure. We're not going to get back the, waving to your neighbor or chatting with your neighbor completely. But there are certain things that we can do. And that's what we try to do with HeroGeneration, to make it as easy as possible to bring in more people into that journey.
Yeah, well, and I know you had mentioned, if your brother brought somebody to the doctor, if they don't have that history, because there's always a question that comes up. And so one of the things that I've seen change over time, my mom lived with dementia for, 30 years. She's been gone 10. My dad had brain cancer. And I was primary for both of those. Back in the day, they did not want you having somebody on the phone as part of that conversation. But now the doctors are, I'm going to scribe this. Do you mind? And they're recording it. So there really is very little resistance now to having somebody on the phone. So even if someone brings them in, and you don't have to drive, you don't have to pick them up, you don't have to be sitting in the waiting room, that can help tremendously. And you can still be part of that conversation as well with that. So there's so many little tidbits that people have to be able to share and stuff. So before we get in too far, I wanted you just to, if you don't mind, maybe give a little background about your co-founder, Dr. Shruti Roy, because people might be interested in that as well.
Sure. So Shruti, I had kind of started putting the pieces together for HeroGeneration, and a mutual friend of ours sent me a post that Shruti had sent or had posted on social media, just talking about the challenges of caregiving. And, when we first chatted, she told me about both of her parents, have struggled with, have been, as they age. Her mom had long struggled with an autoimmune disease, and her dad was recently diagnosed with a brain disorder. And so, coming from her background in medicine, she felt that she should have been equipped, fully to take on these challenges as a caregiver. And, as we know, so much has to be done, and it's so overwhelming. And she talks about just really, when her mother had a hospital stay and was coming out, she went into the bathroom and cried because she did not feel prepared. And she said, if I have a medical background, I am a doctor, and I am feeling this overwhelmed, what is everybody else feeling? How is everybody else dealing with this? And so she posted that social media post, and our mutual friends put us in touch and said, Nicole is working on this to support caregivers. And so she said, absolutely, right away. She had, already decided she needed to take a step back from medicine to support her parents, but she also has 3 young children as well. So, clearly in that sandwich generation. And so she's now dedicating her time to supporting caregivers with HeroGeneration. And it's been, having her medical background and has been an incredible boost to, what we already bring as caregivers.
Well, and I have heard that from so many doctors. They thought they knew, and then you get touched personally, and it's kind of like, what the crap? How can I not know this, or same with professionals in the industry. And I don't care if it's dementia or if it's something else. Someone will get hit personally. And I actually had one guy literally, Nicole, break down in a conference. We're speaking to about 1,000 people, and he's in one of the front tables, and he just started sobbing hysterically. And somebody from the table left and ran to the bathroom, got a roll of paper towel, because the guy couldn't even move. He was just sobbing. Gosh, and I couldn't stop my conversation. Yeah. So I talked with him after. I said, "Are you okay?" And he's like, "Oh my gosh." He says, "Lori," he's like, "I am just so overwhelmed." He's like, "I have been," and he was an executive director in a senior community for 21 years. He says, "I have been advising people wrong for 21 years. I thought what I was doing was correct. But once you step into this, you realize what I was telling people is not what they need." And to me, the biggest piece that is still missing is that emotional connection. You need the basics for medical, but you need to know emotionally, how do you survive? How do you maintain your relationship? How do you structure your day? How do you adapt? And there's no credit given for how draining that is for not only the care partner, but for the patient as well, for your loved one. You're both going through this trauma, and people aren't addressing it other than a lot of times snapping because they're short.
Right.
And that just adds to the chaos and the depletion and stuff. So I just think there's got to be a way, for us to raise the level of that support. Because when people feel balanced, they care better. Yes. And everyone's health stays maintained better.
Absolutely.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
I mean, the statistics on caregiver mental health, 60% have reported depression, serious levels of depression. The health outcomes for just caregivers alone are just really, really, really tragic. And then when you think about, well, they're the caregivers, then what's happening to the loved ones that they're caring for? Clearly, their health outcomes are probably suffering as well. And so, when we really, again, I look at this as just a holistic part of healthcare, especially as we're transferring so much more to, home-based care. We've really, really, really have to focus our resources on caregivers.
I agree. What is one of the biggest things you wish that were different for caregivers?
I wish there was more of an outlet for respite, for a really direct line of either getting a break, because a lot of people try to take things on their own. And I think, there are ways we can do that both with paid professional help and family, friend, help. I really wish that people understood when at the start of their caregiving journey, as soon as they're starting it, what is this going to look like? Now, it's not going to be like we can paint the exact picture of what it's going to be, of course. But the moment people start getting into that role, they realize they're caregivers and what that means. But truly, what does this journey look like? And how can you be supported from day one? Because, we recently asked our community, tell us something that you wish you knew if you could go back and that you started, like you knew at the beginning of your journey. And overwhelmingly, people said, I wish I had brought in more people sooner to support me. And so because there are so many of us who have gone through this, we can share that knowledge. Like, you don't have to walk this journey alone. I really wish we were getting to caregivers at the very beginning. And, because it's like a domino effect. You start exactly like you just explained, you start getting stressed out, you start getting, you snap at your parent, or your loved one, you start resenting, and there's just such a snowball effect of bad consequences. But if we can start giving people community resources from the beginning, I think that outcomes for everyone just will be so much better.
Yeah, I would say too, one of the things that I don't think doctors do well is pulling in the caregivers and the care partners.
Agreed.
And I think that that's something that really needs to be encouraged. And not when someone just gets ill, but just as we get older, things
Agreed.
move so fast. I mean, I think back to my folks. Their appointments, were half an hour, 45 minutes. And now we're in and out in 15, if you're lucky,
Yes.
maybe 20. And
Yeah.
so things are going like this, and you're using different technology and portals that people don't really like, or texting, and how do I respond? And so making it okay, and actually the norm, to have a second pair of ears and eyes representing you, and developing that team.
Yes.
I think we do a big injustice by not calling that forward earlier, and then addressing the fact that when a care partner is in the mix, that they exist in what that role means, as a whole.
Right.
And it's hard because the doctors don't necessarily want to be a counselor, but if they can help if they can help lay the bricks of why this is helpful. Now, when it comes to that, situations with like sandwich generations like yourself, what is one thing you'd like to see different for those that are, I mean, I was one of those too. It's like, okay, I'm working full time. I got a kid. I'm married. I got extra people living in my house on top of caring for my folks. And you're just, it's like, okay, I want to be an octopus. Where's my other arms? How do I grow them? Because I can't maintain all of this.
I mean, can we change the structure of how we care for people in this country? Paid family leave. I mean, that obviously first and foremost would be, there's no greater power than people being able to have the time off and the space to take care of children, take care of parents, and having that be okay. My husband is Australian, actually. And, when I hear about the time off and the resources that they have in Australia, it's mind blowing. It is absolutely, my husband, his father is now in a assisted living home paid for by, the state, and seeing his journey versus my mom, me dealing with my mom and, our finances, having to gather, like really, everything is on us here in the US, so that's a really, really big one, right? That's something that takes years and years of advocacy, and something we support. But I think, getting down to the sort of grassroots level, and again, it's finding ways to bring in your community, both your community that's close to you, and making it okay to ask for help. And then also tapping into the wider community of people that are going through it. Because when you hear other stories, not only are you like, okay, I'm not alone. It's not just me. I mean, I'm a mom, right? And when something happens with my child and I'm like, oh my gosh, and then I hear from another parent, they're like, oh yeah, we're going through that too. It's like, oh God, there's such a weight lifted off your chest about, okay, this is like normal. Really talking about, I don't think caregiving gets talked about enough. Like, I think, with children, it does. And, you find your circle, but being in that sandwich generation, we have a name for it, but I don't think there are enough conversations for people to tap into and see, what other people are doing, what resources there are, just really, really finding that community. And connecting with community and connecting with others is just such a powerful tool, because then you also learn about resources. Word of mouth is one of the biggest resources that people can have and caregivers can have. So I hope that sandwich generation caregivers can really make a point to seek out community, because there are so many more of us out there now than I think in the past. And, until we get paid family leave, and it's a lot easier to care for both generations, leaning on each other is really probably one of the most important things that we can all do.
Yeah, you had mentioned about your husband being over in Australia, and I know overseas, a lot of them, I mean, they get monthly holiday breaks. And it's like, what? I'm going on holiday. Well, what holiday? And it's like, well, no, it's mental health. They understand mental health and how important that is.
Yes.
And
it would make you cry to hear the amount of time off that they get in Australia. It's pretty remarkable.
Yeah, and then some of the countries, like here, it takes a while to even get in for a diagnosis. They'll send out they call them an admiral nurse ahead of time and get them connected and get them prepared instead of leaving them like a fish out of water, flipping and flopping and getting nervous about this appointment coming up. And it's just a whole different mode than what we do here and how we do it. And I think there's a lot that we can learn. I'm going to take a break for just a second for anyone who's just popping in right now. We have been talking with Nicole from HeroGeneration, which is a great platform. She's going to show us a little bit more about that really helps you navigate and keep sane during the caring process, no matter what disease or what age or stage of life you're dealing with. I think you'll find it really helpful. You can always go to their website, which is HeroGen. That's HeroGen.co. They are also on Instagram, YouTube, and LinkedIn. I always like to give a shout out to Q for Good. They are my webmasters. And some people think I'm nuts that I talk about them so much. I love them. And I have had a lot of webmasters that I haven't had that relationship with, and it's been really frustrating. So I love to spread the word of what they do and how they do it. They communicate excellent. They meet their deadlines. They'll hop on Zoom to clarify something, if our messaging just isn't going back and forth. And they work with timelines, even though they're overseas in India and I'm here in Minnesota. We always find, a time that works. They're up late and will still deal with me. And I just appreciate that so much. So if you're looking for a good webmaster, I know how frustrating that can be and how much time it can take out of your day too, to just have somebody at the ready. Check out Q for Good. And if you mention me, you can get 10% off too, which doesn't hurt. Let's get back to Nicole and learn more about HeroGeneration. Do you want to share your screen, Nicole, and kind of show people?
I would love that. Yes.
It's always nice to talk, but it's nice to share too, so people can get a visual.
Sure. So this is the dashboard. So after you've gone through signing up and you've answered a few questions, you are, and you start to use the platform, it becomes populated and it looks like this. But we created the dashboard to really give you a snapshot of what your sort of daily or your upcoming to-dos in terms of caregiving. And as you can see here, it's upcoming tasks and appointment. And these are all can be sorted by what's due today, what's upcoming, what might be overdue that needs to be done. And I'll show how this gets populated in just a minute. But here we've got tips and suggestions that you can scroll through and kind of just to maybe spark something. Oh, yeah, I should do that. And then community events. So you can definitely scroll through upcoming events. And again, like I mentioned, these are all done by organizations that already exist, have really great resources, et cetera. We just wanted to be an aggregator. So you can go through and find those. And there's more events on our events page as well. But this is really kind of where the magic happens or where the magic starts, I would say. This is your loved one's profile. And this is where you store all important information for your loved one. And this comes in handy because, again, like I mentioned, my brother wanting to help.
I'm gonna mention something here. Do you really want numbers showing on the?
Oh, these are all fake. These are all.
Okay.
Yeah.
I just want to make sure. Okay.
Yeah, no problem. Yeah, these are all dummy. Yeah, this is a dummy profile, so it's no problem. So, well, this is actually my mom, but I don't have much of her personal information on here. So, but, obviously, and you bring up a good point though, Lori, because I want to also mention about security. And so with HeroGeneration, we have bank level encryption, two-factor authentication. So when you sign up, or you log in, you have two-factor, you have to, show two different identities for logging in. And then it also automatically times out. So similar to like your bank account, after a certain amount of time, it will time out. So we take security very, very seriously because you are putting some really sensitive information for some. At the same time, we did not want to make it overly complicated and have it be too difficult to get into. And because we know that those platforms and those situations exist with the hospitals, et cetera, and it's complicated. And so we did want to make this as user-friendly as possible. So anyway, getting back to the loved one profile, this is where you can store all the most important information to support your loved one. And this is, again, insurance, active conditions, past medical history, any allergies, pharmacies, link to their website, medications, and the pharmacies that they're part of.
Only two, yeah. No.
I know, right? I know. Again, you can put in as many as possible, but
Yeah, well, I like to mention that because sometimes people don't know what they're stepping into. And like I have one person who's got 14 meds.
Yes.
They take daily. I've got another person who takes 8.
Yes. Yeah. And what I always loved, every single time we would go to a doctor's appointment for my mom, and they would ask about updated medications. And then they would have one that was like from, 3 years ago. She's like, no, I haven't been on that for years. It's like, I thought we updated this, and we're trying to like go through it. And so this is just a really easy place to keep it all updated. And then of course, store legal documents. So your power of attorney, any trusts, any, DNR documents, whatever it, may be. This is a good place, again, just to keep it all in one place. And we love, this is part of the free platform. We love to tell people this. Again, I think, you mentioned it, just to prepare, even if you're not actively caregiving, if you have a loved one who's getting older, this is such a great place to start tracking this information because, again, with my mom, I knew she had also, in addition to her lung disease, she had maybe like high blood pressure, or was it low blood? I don't remember now, but it's something that for me, as I get older, would be like nice to know about her past history as well. So it's just, the more you can prepare for things, it's just makes, when you do get thrown into that caregiving journey, it's just so much easier. So that's the loved one profile, very easy to upload documents. And then I'll also mention, you can invite as many team members as you want. So maybe it's your siblings, maybe it's a neighbor who can help with groceries or so. But you can also change their level of visibility. So Care Hero would be like a sibling, somebody who can see everything. If you only want the insurance to be seen by them, the legal documents, et cetera, you can manage who sees what at any given time. And really, again, to have a protective layer, but still bring in an expanded team. Easily invite team. And again, as I mentioned, you can make them a team member or a Care Hero. But here's really where, again, the magic happens. And so this is the task and calendar management. You just easily add a task. So again, like I mentioned, ordering the shower seat, right? You often have to get so many medical supplies and those costs just add up and add up. I say caregiving is always like death by 1,000 cuts because it's just one thing after another that you don't even realize. You know what? That my aunt who said, what can I do to help? Can you just order this shower seat off Amazon for me? Or can you just order groceries to be delivered this week? Can you, pay for the Netflix account this month? You can start to offload those, and here you easily, just change the category, the assignee. So you can add your sister, your uncle, whomever it may be, or you can leave it unassigned. And people, you can say, just go in and pick up something that's unassigned and just do it for me, please. But you just assign something to your loved one or to your team member, and they receive notifications that they've been assigned a task. And just like that, They go in, they do it, they go in, mark it as done, and it's just taken off your list. And so,
can I ask a question there? So if it's unassigned, how does it show up on the panel then?
So it'll be here, it'll show as unassigned. So if I go here and I just leave it unassigned and then update it, it will be unassigned. And then anything that's like that, somebody can go in, they can go into it, go in there.
Nice and simple to see.
Yeah. Very easy. So yeah, I mean, that's really the bread and butter of HeroGeneration. Again, it's just offloading the millions and millions of to-dos that keep coming up. In addition, there's messaging within the platform. So oftentimes you're maybe on a group text or a WhatsApp or an email, and you're like, where did we talk about that? We wanted to give people a place where they could just talk about the caregiving situation and keep it all in one place. You're not searching through all of your messages and saying, where did we talk about, the blood pressure level, or where did we talk about, the signs of mom's Parkinson's that are progressing. And you can have that all in one place. Same thing with notes. You can add notes, for my brother, when you go take mom to the doctor's appointment, here's what's been going on in her situation. Can you talk to him about this? He can he can read the note, he can leave messages, and it all is in one place. So that's really the overall sort of collaboration tool. Again, we have, as I mentioned, the community. So, these are all events that you can search through, find something that works for you, and really connect with other caregivers. In addition to our resources, we have a resources page that really covers all kinds of conditions, situations, etc. And it's really got great tips, great overview, and it's coming from the caregiver's perspective. So we share caregiver stories, we share in their shoes, so you can kind of understand what it's like for your loved one who might have dementia, who might be struggling with anxiety or has just had a stroke, to a degree, understand what their sort of perspective and point of view is. And then the final, really great feature that I love is our Ask Andrea. So this is our AI digital caregiving assistant. You can ask her any question related to your situation, and she will come back with a tailored answer just to your situation. So those nights when it's, 3 a.m. and you can't sleep because you're thinking about what's going to happen, with mom's cancer, or, the MS is, this is what she's just diagnosed with MS. What am I going to do? Where do I even begin? You can have a conversation with Andrea, and she really comes from it from a really empathetic voice and empathetic mindset, which, for caregivers, which was really important to us. So to continue saying, take a break from caregiving, you're doing a great job. I know this is difficult. I'm sorry to hear about this. It's just really an empathetic voice that you need to hear. And it's resources that are tailor-made for whatever your situation is. So that's really the overview of HeroGeneration in a nutshell. It's free to sign up. There's a free part of the platform. Again, that's the loved one's profile. We do have a subscription where you can get some of the task and calendar management, et cetera. But we really built this to support caregivers and, from a caregiver perspective, and try to offload a lot of the stress and complexity that we know caregivers deal with on a daily basis, try to offload it to support, to bring in more people into the journey, as we've talked about, and offer greater support. So you're not
caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Not having to do it all by yourself.
Well, this is very comprehensive. I love normally I don't like the AI. And why I don't like the AI is because I'm so used to it from a support website that keeps asking me questions that aren't pertinent to my question to begin with. And they just keep looping it over and over. Same with the phone system. It's just like, I thought you're supposed to be smarter than this.
Exactly.
It isn't getting anywhere. I'd love to ask her if she has tips to get through to Medicare and the insurance companies and IRS and things like that a lot of times you just get looped through.
You can, Medicare, and you can ask about that. IRS, she may come back and say that's not, she really, if you try to ask questions outside of caregiving, she won't, she'll just say, I'm sorry, I'm not able to answer that. But I will say my husband, there's a very specific process in Australia that you have to go through to get your, aging loved one into elder care or assisted living, whatever it may be. And she came back with the exact process, even in Australia. So she's very, very comprehensive, and continues to learn. And, where we want to really take it is when she suggests something, she can then put it into your HeroGeneration account. We're not there yet, but, she'll say, do you want me to add that to reach out to, an elder care attorney or to, talk to somebody about your will and trust or, power of attorney for your loved one, whatever it may be. So there's so many, this is just the beginning. There are so many ways I believe that we can translate that just to make it a little bit easier and not be that, spiral of death that we often get from those AI chatbots on like customer service.
Yep. Yeah. Well, and this is, everyone says how they're so intuitive and it's really easy to use, but this really, to me, seems very simple to use and black and white. Because a lot of times they'll see the back end and I'm like, no, this is easy for you, but it's not going to make sense to the general public all the time. So I think you've really done a nice job with design and things on that. Now, can you add like doctors and stuff and then assign what they can see or not see?
No, not yet. We're not there yet. Partially because, we would have to follow some pretty strict HIPAA rules then if we did that. And there's a balance, right, between wanting to include your doctors and connect with the medical system, but then you start to add layers of complexity that you just talked about. And so we are very conscious of making this as simple as possible for caregivers. We don't want to duplicate what already exists in terms of like the EMRs, et cetera. But, we will eventually incorporate a lot of integrate with the medical data. But right now we just want to keep it simple so that it's not a pain for caregivers to have to use.
Yeah. Well, and the thing is, if you have it in one spot, it's a copy and a paste to drop into your doctor's portal or something, because that can do more harm than good sometimes with all of that. The other thing I just wanted to mention was when you were talking about, where did we have that conversation? Was it an email? Was it a text? Was it blah, blah, blah? Facebook? I cannot tell you how much time I've wasted, because everybody uses something different in the family, or the team. And if you can get them all filtered in, oh my gosh, that alone will save you a ton of time. With that. And it's those little things you don't realize until it hits you. And then it's like, I've just spent an hour scrolling through texts and, seeing who did I say that to? I know it was somebody on the team, but I don't know where. And then you're trying to share it with somebody else. And that whole resharing thing gets exhausting as well, too. So, and this way you have more consistent messaging, better open communication. I mean, people can see, depending on how you have them built in here, big picture, little picture, very specific in terms of what's what. But is there a limit of number of people you can have on your care team?
No,
Okay.
you can invite as many as possible. Yep.
So that's nice too. Gosh, just a really, really nice job in terms of how you coordinated this. I know you have, even a broader vision, as you go forward and stuff. And I know people don't always want to say what that is because you want to control competition and things like that.
Sure.
And so but you've touched on so many things. Now, in terms of, you said there's a free one. Is that only for a limited period of time or?
No. So when you sign up, you get a 2-week free trial and you get the entire platform, all the features to test out for 2 weeks. And then after that, you can choose if you want to stay on the free plan. And what the free plan includes is a loved one's profile. So storing all that information all in one place. You can hold on to that in perpetuity. That is all included. And you can also invite team members to view that information. With the paid plan, that's when and it's $17.99 a month. So it's, pretty affordable. With the paid plan, you get all the task and calendar management, the messages, notes, the AI caregiving assistant, in addition to some, specific events for members and other sort of like resource events as well.
Okay. Do you envision in the future having like a family plan or where you could have multiple people in a family for a subscription? Because I'm thinking of, especially with kids with parents, a lot of times, but again, it could be a young couple just trying to manage their own kids stuff too.
So at the moment, you can have as many loved ones. You can add you pay per loved one. So you can add, as you can see, my children are also on here in addition to my mom. So you can add loved ones as well. Is that what you're referring to?
Yeah, I didn't know if that was another, $17.99 a month per person.
Yes. So currently it is, and we're relatively early, so we're, figuring out what makes sense for pricing, et cetera. So yeah, I could see in the future there may be, like a cost savings for multiple loved ones as well. Likely in the future, yeah, but you can add as many right now as you want.
Okay. One of the reasons I ask is, not only can kids have, maybe more, and I'm just going with elderly because that's just kind of an easy place to go. But a lot of times within the family, it's like, okay, so we've got 2 elder parents here. And you've got a sister-in-law whose parents have always been really free and independent. And then, we hit crash mode.
Yes.
And something happened. And now they need something like that or a referral system or something. I don't know. I can just see where once people see this, an expanded piece there, that would be possibly interesting for people on that. Gosh, this is just so fantastic. I'm just thrilled that you're able to show this to us. Anything that we haven't covered that you'd like to cover?
I think, as far as the platform goes, that's it. And our intention, our mission, I think it's clear. We really are here to support caregivers. So one thing I would say to your audience, if you see this and you have ideas, or we're constantly taking feedback, particularly for the platform, because that's something we can control, but just in general, listening to caregivers, what they need, how we can support them better. I would invite all of your listeners to, if they have ideas, to email. It's just hello@herogeneration.co. We would love to interact. We would love to have that conversation with them. And both Shruti and I are totally open to even having, Zoom discussions. And we're at such an early stage in this, and we're really trying to be as close to our users and caregivers as possible to ensure that we're building a product that is, in fact, as useful and easy to use and seamless. It's one thing to build it. If it's more work to use, then, that's not helping anybody. And so we want all that feedback. And I would, be completely open if folks want to reach out to us about that.
Sure. Okay. Well, wonderful. Well, Nicole, thank you so much for your time today. For our listeners, I always ask you to be a giver of hope. Like, click, and share. There's always people in your sphere that need this information, don't know where to look, or haven't maybe even told anybody that they need help, but they're thinking about it, because caregiving it's a weird thing, because people can be embarrassed when they feel like they can't handle it. They feel less than, because that's the pressure society's put on. And that's a stigma that really needs to change. It does take a village, and, we're all better off, I think, working together. It removes stigmas, and it makes people feel purposeful. I know I wasn't good at accepting help from people because I thought I was supposed to do it myself. And then all of a sudden, it kind of like slapped me in the face going, it makes me feel good to help. Why am I not letting other people help? They want to, and we just have to educate them a little bit if things have changed as to how. But there's so many different levels of care, like you said, from going to the doctor, picking up a prescription, or maybe cutting the grass, or taking somebody for a walk, or out to dinner, or the list can go on and on and on. And so, look at all of those areas that you feel bogged down on. It could be doing meal prep or laundry, or just not having time for yourself, making sure that you can push some of that other stuff off to have time for yourself. And, I was not good at that. And I didn't know that I wasn't good at that until really late in my journey. And actually, after it was over, I found this really fascinating. I had a client when I sold real estate. They had bought and sold several homes from me over the years. And I was sitting down having a beer with them or something. And the woman said, "Oh my gosh, your eyes are gorgeous." And I said, "Oh, thanks." And she says, "No, Lori, you really need to understand the difference in your eyes." And I said, "Well, what do you mean?" And she said, when you were in the thick of things caring for your mom and dad, they were like black.
Wow.
You were still really charming. You did a great job. But your eyes, and my eyes change color from green to blue and stuff all the time. But I thought, wow, I never noticed that difference at all. And so pay attention to those things, because it was really easy to overlook, because we're always moving too fast and thinking about everyone but ourselves. And we have to maintain our care partners and our caregivers, because too often they get ill or pass first because of this stress. And it's really so often needless. There is help, and there are resources, like HeroGeneration, that can make things much easier.
Yes,
So,
absolutely.
So again, thank you so much, Nicole.
Thank you, Lori. Thank you for the platform. Thank you for all that you do as well, and having your voice and using your voice for so much good and for caregivers. It's really inspiring, and that's what Shruti and I take with us, and we take your energy and everything that you do and others, and really put that into what we hope is also supporting caregivers as well.
Wonderful. Until next time, we'll see you later. Bye-bye.
Bye-bye.
Attention seniors. Are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.